Horner syndrome is a neurological disorder caused by disruption of the sympathetic nerves that connect the brain to the eyes, leading to symptoms such as unequal pupil size, a drooping eyelid, ptosis, and reduced sweating on one side of the face, anhidrosis. It typically arises when an underlying condition, such as a carotid artery dissection, lung tumor, or cervical spine issue, damages the sympathetic nerve pathways in the head or neck. Carotid artery dissection is a serious condition in which a tear forms in carotid artery of the neck, causing blood to leak into the artery wall and split apart its layers. While most cases are acquired due to these medical triggers, congenital forms present at birth are rare. A 45-year-old woman comes to the physician for a routine visit. On physical examination, her left eye appears abnormal. In addition, her left pupil is constricted, but reacts normally to light and accommodation. The left side of the patient's face is dry and flushed. On questioning, she states the left side of her face has become abnormally dry. What is the most likely diagnosis? The most likely diagnosis is Horner syndrome. What is the pathophysiology of this condition? Horner syndrome results from a disruption in the sympathetic innervation of the face and eye, and subsequent unopposed parasympathetic activity, which produce the classic symptoms. Ipsilateral ptosis, slight drooping of the eyelid, as seen in the figure, anhidrosis, absence of sweating, and miosis, pupillary constriction. The mnemonic is PAM. What nerve pathway is disrupted in Horner syndrome? The first neuron of the sympathetic pathway begins in the hypothalamus and synapses in the intermediolateral column of the spinal cord near T1. The second, preganglionic neuron, sends fibers to the superior cervical ganglion. The third and final neuron of the pathway innervates the pupillary dilator muscle, the sweat glands of the face, and the smooth muscle of the upper eyelid. If this patient presented with nystagmus to the left side and frequent falling, what acute condition should be considered? Wallenberg syndrome results from a stroke in the lateral medullary region, supplied by the posterior inferior cerebellar artery. It can present with ipsilateral Horner syndrome, nystagmus to the opposite side of the lesion, ipsilateral limb ataxia, and vertigo. Ataxia refers to impaired coordination of voluntary muscle movement. Another distinguishing feature is impaired pain and temperature sensation in the ipsilateral face and contralateral body. What are other common causes of Horner syndrome? Any pathology that interrupts the described pathway can cause Horner syndrome. A number of etiologies can occur, such as Pancoast tumor, Brown-Séquard syndrome, spinal cord lesion above T1, Syringomyelia, and chest wall trauma. Brown-Séquard syndrome is caused by damage to one half of the spinal cord, that is, hemisection of the spinal cord, resulting in paralysis and loss of proprioception on the same side of the lesion, and loss of pain and temperature sensation on the opposite side of the lesion. Syringomyelia is a neurological disorder in which a fluid-filled cyst, syrinx, forms within the spinal cord. The syrinx can get big enough to damage the spinal cord and compress and injure the nerve fibers that carry information to and from the brain to the body. What is Pancoast tumor? Pancoast tumor is a carcinoma that usually occurs in the apex of the lung. It can cause Horner syndrome by compression of the superior cervical ganglion and ulnar nerve pain.